Bismillahirrahmanirrahim. I start the CMA with the name of Allah, who is very, very kind, helpful, and merciful. CMA update by Mother and Child Survival Group of Pakistan. CMA tips. Me, Dr. Tariq, Obs-Gyne Family Emergency Specialist, Internist, Gulf KSA, presently a district gynecologist. We are going to discuss laparoscopic obstetric and gynecological injuries to the internal organs, which includes injury to the underlying vessels, abdominal aorta, and to the bladder and to the gut, small intestine and large intestine. In the previous, we have discussed about the repair of a laparoscopic gut injury. If it is small, if a varices needle is the culprit, then we can repair the gut, clean the toilet, fecal toilet with saline and other, and then can close it with start of antibiotic, nasogastric suction and fluids. Triple antibiotic. How you recognize? Because once you enter with the laparoscope, you find fecal matter in the abdomen, and then if it is a trocar, then it is a injuries more. You can do it with laparoscope, and you can involve the surgeon, and you can also involve a senior gynecologist and all the in a team, and laparoscopic surgeon who is expert in repairing such type of injuries. And if you see that the trocar is the one and there is extent of more injury to the bladder or to the gut, then laparotomy is to be done to see the extent of the lesion. And if you see that the gut, large gut is injured, then you have to do the repair the gut in with the absorbable suture, in absorbable sutures, and with the inverted colonic mucosa. And then think of the defunctioning colostomy, so that the this previous injury to the gut heals in 6 to 12 weeks. Now we come with another injury, and that is laparoscopic injury to the bladder. As I have told that the injuries to the abdominal aorta and to the other internal artery and to the other vessels, underlying vessels, are common, and also injury to the gut. And now this we are discussing the laparoscopic injury to the bladder. This can be detected with the hematuria, and there is a pain and there is a superficial tenderness, and you will see laparoscopically that the balloon of the catheter is visible. So you have to arrange for the repair. If it is important that you involve a urologist and also involve your senior gynecologist. The urologist expert at laparoscopic repair and laparoscopy, or if it is the extent is more, or if you have already opened during a gynecological and obstetric surgery like hysterectomy, or by cesarean section, if there is an injury to the bladder, then that can be easily repaired with an absorbable sutures and double layers and with a watertight seal, and that can be checked through retrograde filling by the saline and or retrograde filling by the methyl blue dye, which can easily check it, the watertight closure. And then you can, as I have told you, the laparoscopic surgery, you have to involve the urologist input as well, who is expert in this laparoscopic repair, that are also doing laparotomy. So this then catheter is held for at least 2 weeks to 3 weeks continuous, and then you have to add antibiotics, and then you have to arrange for the uh, daily washing of the bladder. As I have told you, that sign symptoms are uh, that you have the pain, you have hematuria, you have blood clots, and you have also bruises and tenderness above the skin. So this easily you can also check it by retrograde cystographic filling of with the dye or with the saline or with the cystography. You can check it. And the most important is the CT scan for the detection of the bladder injury, and cystoscopy, and uh, these are the modalities which we use for the diagnosis. And if it is already open in an obstetric operation, and then you can also find the Foley's catheter. So you have to give a good combination of antibiotics for gram positive and gram negative fluids also for the drainage, and you have to make sure that it is a tight water seal closure with double layers in absorbable sutures. And then you have to add antibiotics, and then you can add the thromboprophylaxis also. And then post-operatively, you have to care the catheter to be for 2 weeks and the 3 weeks, depending upon the extent of the injury. And you have to monitor for the urinary tract infections and the cultures. And after cultures, you can prescribe suitable antibiotics. And post-op care is also very important, and then bladder drainage is also very important. And these has the power of the bladder injuries due to laparoscopic surgery or due to gynecological obstetric surgery like hysterectomy or cesarean section. It depends, previous one or two. If there is uterus rupture, there is an IUD, then bladder is also liable to rupture because of the effects of misoprostol or syntocinon, or with the strong labor pains. So post-op care with the antibiotics, and for the prolonging of the catheter and doing the culture to see the urinary tract infections, and management of post-operative by later on. Pelvic floor exercises are very important, and healthy lifestyle and increase in the fluid, that is the most important part. So this is the brief review of bladder injury, and we'll come with another one. And pray. Our takeaway message is pray, praise, trust, love, worship Allah, and follow Suhasna Sallallahu Alaihi Wasallam, our health and survival. And we must not forget our past. Allahumma la ilaha anta subhanaka inni kuntu minaz zalimin. Allahumma قل هو الله أحد الله الصمد لم يلد ولم يكن له كفوا أحد لا إله إلا الله محمد رسول الله وكفى بالله وكيلا وكفى بالله نصيرا حسبنا الله ونعم الوكيل. Thank you very much for a very patient listening, and inshallah we'll be presenting with another review. Wama alayna illa al balagh. Thanks and best wishes and regards.